So our next topic is changing pattern of disease. We have understood different disease patterns, and the shift from infectious diseases to non-communicable disease as a burden of to today's society. This transition is across different regions and different populations. So first we'll talk of developed countries and then we'll talk of developing countries. So disease pattern in developed countries. Developed countries have non-communicable disease revolution. Why is it so? Because these are characterized non-communicable diseases are characterized by like no means they are not infectious, but they are mostly for lifestyle factors. They lifestyle factors are involved in this. So disease like TB, polio, diphtheria, they are highly controlled through successful vaccination programs and improved sanitation and better nutrition. But this non-communicable diseases, because they are through lifestyle behavior, it is not means they are not able to just control this these diseases. So how much burden is there, or what are the various chronic non-communicable diseases which are at present uh, in developed countries and posing threat? These are four. These are four cardiovascular disease, cancer, diabetes, and chronic respiratory disease, particularly COPD. So cardiovascular disease, like we know, heart disease and stroke, it is a leading cause of mortality. And it is driven by lifestyle factors like sedentary behavior, high fat diets, tobacco use, and chronic stress. So coronary artery disease, hypertension, heart failure, these are posing very much and very significant amount of health burden to the health organizations in developed countries. Cancer, cancer is again affecting and reflecting multiple factors, because multiple factors which are involved in this is aging population, environmental exposure, lifestyle choices, and improved diagnostic capabilities. So the improved diagnostic capabilities means the patients or the people are going for screening of disease for and going for multiple CT scans and MRI scans, and they are just risking their life to the various radiation exposures. So that are posing the various cancerous things to the people. Next is diabetes. Diabetes has reached epidemic proportions in developed countries, and now it is very it is also a threat to developing countries as well. So this is closely associated with rising obesity, decreased physical activity, and dietary changes. And this condition complications affect multiple organ systems, so it requires comprehensive management approaches so that this diabetes can be controlled. Next one is chronic respiratory disease, particularly we are talking of COPD and asthma in it. And primarily this occurs due to tobacco smoking, air pollution, occupational exposure, and environmental allergens. And new and emerging health challenges what are coming are neurological and mental health disorders. So nowadays we are also seeing this mental health issues in our developing countries also. India is a developing country, so we can hear these emergence of mental health issues in our country also. Next is substance related disorders like alcohol and drug addiction. Plus, developed countries have opioid crisis also, and it exemplifies how substance abuse can rapidly evolve into a major public health emergency. Lifestyle related conditions, it is all covered. Sedentary lifestyle is the means root of all the diseases. Environmental and occupational health issues are also coming up, like increased industrialization, increased urbanization. They have introduced new health hazards to the community. by exposure, giving them exposure to carcinogenic chemicals, pollution, and occupational toxins also. If we talk of disease pattern in developing countries, so in developing countries, still the infectious disease challenges are persisting, means they are having the double burden of disease. Infectious diseases are not going, and non-communicable diseases are emerging, right? So among your infectious diseases, we have diarrhea, respiratory tract infection, vector borne diseases, bacterial infections. Plus, we do have nutritional disorders also. We have various maternal and child health issues also. And maternal and child health issues are they are very much infectious, and infectious like diseases born to the pose very threatful conditions or threatful insights into the newborn babies. So it is due to limited access to skilled birth attendance particularly. So this is a very big health challenge in emerging conditions, sorry, in developing countries. So emerging non-communicable disease, again the same: diabetes, cancer, and cardiovascular diseases. So these are non-communicable disease which are coming up in developing countries. So what are the factors driving disease pattern changes? First one is urbanization effect. Developing countries are migrating from rural to urban areas. They have changed their dietary patterns. They have reduced physical activity levels. Exposure to environmental pollutions has increased. Social stress, lifestyle changes. Then access to healthcare is also an impact, is imposing economic impact on them. So these are all certain factors which are driving the disease pattern changes in developing countries also. Next one is occupational health concerns. Yes, of course. So in developing countries also, all these four uh, factors, all these four health problems are persisting, particularly occupational diseases, environmental pollution, workplace injuries, and chemical exposure. So, if we compare the global health disparities among developed and developing countries, so we'll see that healthcare system in developed countries emphasize on chronic disease patient, while the developing countries have dual focus on infectious and chronic diseases. Then in developed countries, the long-term care systems are there, while in developing countries, basic in healthcare infrastructure development is still going on. They provide advanced diagnostic and treatment technologies, but still in developing countries, we are dependent on the immunization and disease prevention initiatives. So, what are the contemporary influences on the disease pattern? Particularly the globalization and health, technological advancements, climate change, social determinants, evolution. These all have contemporary influences on disease pattern. Means if global supply chains are robust, they affect the food security, they affect the nutritional patterns worldwide. If the technology improvements are there, diagnostic capabilities are improving, but diagnostic capabilities are imposing a threat as the cancer is developing in the people. So there are various influences of certain things on the health of people in developed and developing countries. So, what future implications or trends can we suspect? So, predicted disease pattern evolution, if we talk of, then there is, yes, of course, the rise in non communicable disease globally, because we saw that developed countries are having the non communicable diseases, but the developing countries are moving towards non communicable disease. The persistent infectious challenges are still there. Emerging diseases from environmental changes are coming up. Mental health conditions, non communicable disease plus mental health conditions, these are prominent worldwide. So, what health systems should do, how do they evolve to address these changing pattern of disease. So they should have integrated care models. They should focus on prevention category of things, interventions. They should have community based care systems. Global health security preparedness should be there, and health equity initiatives should be promoted. So understanding this will give or it requires continued investment in epidemiological surveillance system, technology development, social research, determinants research, climate change, global health policy analysis, and overall. So it gives the landscape of global disease patterns. So successfully, if we are addressing these changing patterns, we require adaptive healthcare system, international cooperation, and sustained commitment to health equity and disease prevention. So this is all for your developed and developing countries changing pattern of disease.